Om Shanti.
So after a day-long marathon of sessions, I guess, you must be very comfortable and relaxed now, having had a substantial dinner and all. तो ये जो हमारा एक छोटा सा एक इंटरैक्टिव डिस्कशन पैनल डिस्कशन है, अक्सर ये प्रश्न उठता है कि भाई डॉक्टर्स हैं आप लोग, आपकी प्रोफेशनल लाइफ शुड बी, कई लोगों का तो मंत्र होता है ना कि वर्क इज माय लाइफ, वर्क से ऊपर कोई बड़ी बात नहीं है।
Some people have mantra that work is life. More than work, nothing is there.
अपने वर्क को सबसे बड़ी इंपॉर्टेंस देते हैं, उससे बड़ा कुछ नहीं। मैं पेज
They
पे
give
लिखता हूँ
importance to
वर्क इज
work
गॉड,
and they say
तो
that
मुझे
work
लगता
is
है कि
God.
ये वर्क इतना इम्पोर्टेंट है
Work is this much
और
important for
प्रोफेशनली
doctors,
एक नेक्स्ट टू गॉड भी कहा गया है।
and doctors are called as
तो
next
अगर
to
आप कहें
God.
कि नहीं आप इतने डीपली स्पिरिचुअल है, आप स्पिरिचुअलिटी के बारे में लोगों को सिखा रहे हैं और खुद भी प्रैक्टिस करते हैं और साथ साथ एक परिवार में भी रहते हैं,
People
तो
say that
दोनों
you are
चीज़ों
in
को कैसे
spirituality
कैसे आप
and how you are balancing both spirituality and your profession.
अक्सर ये कहते हैं लोग कॉन्फ्लिक्ट ऑफ इंटरेस्ट है डॉक्टर साहब आपकी लाइफ में, एक
And
तरफ
people
आप
say that,
एक्टिव है,
doctor, you have
एक तरफ
conflict
आप
of interest.
स्पिरिचुअल हैं,
One way
तो
you are
दोनों
going
को
into
कैसे
spirituality and you are
किसी भी
practicing
सुबह
everything.
से लेके रात तक
4 o'clock you are
सब
getting
कुछ
up in
निभा
Amrit
सकते
Vela
हैं और खुद से
and
भी
doing class,
पूरा का पूरा सब कुछ प्रैक्टिस
and
करते हैं,
also
तो इसमें
professionally you are
आपको
practicing everything.
कहीं थोड़ा बहुत भी
So
सैक्रिफाइस लगा होगा।
anything
तो ये
compromise,
जो सेगमेंट है,
anything you are
ये मेरे
compromising in
स्टूडेंट्स
your
के
life,
लिए
in
सही
that way
है
people usually
जो
ask
प्रैक्टिस
me.
स्पिरिचुअलिटी फॉर ए वेरी वेरी लॉन्ग टाइम।
So now
मैं डॉक्टर गौरव अग्रवाल हूँ, मेडिकल लीगल कंसल्टेंट, हैविंग क्वालिफाइड इन फोरेंसिक एंड देन एलएलबी लॉ में, और आई बिलोंग टू दिल्ली। तो मेरे क्लाइंट्स अक्सर डॉक्टर्स होते हैं जो प्रॉब्लम में मेरे पास आते हैं।
most of the clients
सबसे
are
पहले
doctors
जो
and
होता है
they come to
सबसे
me with their
पहले हम
problems.
हमारी बहनों से हमारे डॉक्टर्स का स्वागत करेंगे
I
वैष्णवी।
request now sisters of Brahma Kumaris to welcome the
On my
doctors.
left is Dr. Brajesh Jindal, he is a urologist।
On right, Dr. Brijesh Singh, urologist from Gwalior,
Brajesh Singh owns Navjeevan Hospital, a 55-bedded hospital।
from Navjeevan Hospital, which is a 55-bedded hospital.
यहाँ पर आए
He came leaving his
तो
hospital.
बताइए कि पूरा हॉस्पिटल कौन चला रहा है।
Now he will tell you who is running his hospital when he is here.
हेड ऑफ न्यूरोलॉजी वर्ल्ड मेडिकल कॉलेज,
Dr. Kiran, head of neurology department.
at the Institute of Human Behavior and Applied Sciences in East Delhi. Now she is at World Medical College at Jajjar।
Now she is at World Medical College, Jajjar.
Thank you, sisters. Dr. Binni Sarin,
Dr. Binny Sarin,
Human Relations Officer at
Human Relations Officer in Global Hospital.
की इंचार्ज हैं।
She is initiative of Global Peace Program.
कैंप इनॉग्रेशन के समय
Dr. Pratap Mitra,
एडिशनल डायरेक्टर ऑफ
he is additional director of Brahma Kumaris
प्रेसिडेंट मेडिकल विंग ऑफ ब्रह्मा
and vice president of Brahma Kumaris.
अभी पहुंचने ही वाले हैं शिव। तो मेरा सबसे पहला प्रश्न डॉक्टर किरण बाला दीदी से है।
First question is to Dr. Kiran Bala.
एमबीबीएस स्टूडेंट्स को पढ़ाते हैं,
She teaches MBBS students. She is head of neurology department.
एमडी स्टूडेंट्स होते हैं, डीएनबी स्टूडेंट्स
MD students and DNB students will be there. She has to take care of ICU and she has to take care of the OPD and she is also taking care of her family.
और एक स्पिरिचुअल लाइफ।
Sister, how are you taking care of both your family and also your professional life? How do you handle so many responsibilities? Om Shanti. He asked me the right question. Many people ask me, despite of this busy schedule, how are you able to do these spiritual practices?
That
31 years back, I joined Brahma Kumaris. I did course. This question I asked my teachers who taught me Raj Yoga course. After teaching the course, they told me that you have to come daily to Murli class. I asked them how it is possible. Then I was doing Then I was doing senior residency in medicine department in Gangaram Hospital. I can't come to center to listen to Murli, I said then. Then slowly I realized that in life I have some priorities. Whatever I like, whatever I have a preference, I have to take time for that. And then God also helps us. I have seen that situation becomes like that. The daily I used to go to center. I used to enjoy it. After senior residency, consultancy, and then teaching programs. And then I became a neurology teacher. And then I started teaching DNB students. And I have seen that when our schedule goes in a disciplined way, एक time schedule बन जाता. And then I started practicing regularly. Then actually I felt that there is lot of time, and after practicing meditation there was no waste time, and the remaining time which was left without any waste, that I used to utilize for my family. So I taught to my children also Raj Yoga, and they also cooperate to me now. Now I feel that the things are happening by themselves.
ठीक भी दीदी। तो
Thank you,
सुबह
sister.
उठने में कुछ मतलब इतना समय कैसे मिल जाता है आपको सुबह इतना
Did you ever felt how do you get lot of time
फिर भी
to get up early in the morning, to do lot of activities,
लाइफ को भी देखना
and you
चाहिए।
have to take care of your family? How are you getting time for all this? How much time you spend in spirituality daily? I do I do meditation in the morning. After that I attend class, and then I take my center. I take my tiffin and then go to center and then go to hospital. In the hospital we made a meditation room.
डॉक्टर अशोक मेहता राइट, प्रेसिडेंट
He is
मेडिकल
Dr. Ashok Mehta, President of Medical Wing Brahma Kumaris. He is a senior oncology surgeon.
prestigious डॉक्टर पीसी रॉय अवार्ड।
He received BC Roy Award.
ही इज बेस्ड इन मुंबई।
He is now in Mumbai,
ही इज करंटली वर्किंग विद लीलावती हॉस्पिटल मुंबई।
currently working in Leelavati Hospital, Mumbai. Whenever I get time in between, I remember God. Whenever I get time, I connect with God. Then my decision power increases, and I quickly decide what I have to do for patients, what I have to do for my department, and then my time will be saved. And your staff also becomes supportive when you practice meditation. They start helping you. We have prepared NABH documents. We didn't know NABH, A of NABH also, but we have prepared all the documents. With the help of Almighty only we could do that. It's like I used to take advice from him, like he is the head of my house, he is the head of my family. In that way I used to take advice from God. And then everyone starts understanding, everyone starts helping, and everything becomes very easily.
अपने घर का हेड बना लें, उनसे
If we make God as head of a family and take advice from him,
फिक्शन है, कहानियाँ हैं।
then things become very easy.
टॉक टू गॉड,
When you talk to God,
व्हेन ही इज टॉकिंग बैक टू यू,
and then you can understand that God is talking back to you.
आता है। और डिसीजन मेकिंग में जैसे दीदी ने
You develop faith, and in decision making it helps a lot when you talk to God.
डॉक्टर अशोक मेहता भाई साहब,
And the next question is to Dr. Ashok Mehta.
डॉक्टर साहब इस
How do you maintain balance?
प्रोडक्ट्स onco surgery, you typically take several hours.
Oncosurgery takes several hours
आप कैसे
for a
बैलेंस
single
करते हैं
patient.
अपनी
So, sir, how you are maintaining the balance between your professional life and
Dr.
spirituality?
Vijay Singhal in the private sector, owning and running a nursing home. Dr. Ashok Mehta lying in a corporate hospital.
Dr. Brijesh Singhal owning a
Binny
hospital,
Sarin in
Dr.
a
Ashok
private
Mehta in a corporate
global
hospital,
entity.
Dr. Binny Sarin,
PRO at a
PRO
global
at
hospital.
Global Hospital,
Administrative head
and administrative head
Dr.
Dr.
Pratap Midha.
Pratap Midha.
Sir, please. As a matter of fact, I think when we work only in a professional way, there is imbalance. As a matter, when we join the spiritual movement, the Brahma Kumaris, I think we bring a balance in our life.
When we start spiritual life, then balance automatically comes between professional and spiritual life.
Whatever is normal in life, what we think at that point of time,
What we think as normal, like
we
competition,
realize
after coming here, we realize that
life is very short.
life is very
We are
short
left of God, and we want to make
and
the
you
best
want
of
to
it
make the best of it
by doing why we are here.
by doing why we are here.
Very nice. So she passed away in 104.
Badi Dadi, she passed away in 2004.
I come, where I come, was a
Dadi
challenge.
Janki used to say,
Who
who
am I?
am I?
Who is he?
Who is he? And to whom I belong?
Aim in life.
What is my aim in life?
I think those three questions,
These three questions all of us have to ask ourselves.
in the practice, when we see a lot of people dying in front of our eyes,
When we see a lot of people dying in front of our
we see
eyes,
our family members dying,
we see our
we
own family members
cannot
dying,
compare, especially when we are challenging diseases like cardiac disease or
and they are
diabetes
passing through many challenging diseases like cardiac diseases,
or cancers or
cancers,
any major operations.
and any major operations.
I went through 5 major operations in my life.
I went through 5 major operations in my life.
It was a challenge.
Each
And
of
at
one
32,
was a big challenge.
in America, I had a massive bleeding.
I had a gastric massive bleeding at 33 years of age.
Major surgeries.
2 major surgeries were
No
done.
MRIs, no CT scans. This was in 1970.
In 1970, there were no MRIs, no CT scans.
I'm 33 years old.
I was just 33 years old.
My daughter was 24 years old.
My daughter was 4 years
I
old.
always wanted to live. I didn't want to
I
die.
wanted to live
Many
and I didn't want to die.
surgical oncology. And at that point, I had undergone a major operation of
Then I have undergone a major surgery.
acute erosive gastritis.
Then they have diagnosed as acute erosive gastritis.
Some pain relieving drug I had taken.
Because of pain relieving drugs, I got that.
Cold climate for which my body was not used. And there was a stress of the cold weather, and I had this massive pain. I am not always paining, but afterwards I developed subdiaphragmatic abscess.
Afterwards, I developed subdiaphragmatic abscess, which was not diagnosed for 15 days. I got pain in the left shoulder, and they told that you are imagining things. When I got 105 degrees temperature,
I could not breathe.
then I could not breathe, and then I was admitted.
My subdiaphragmatic abscess
My
opened
subdiaphragmatic abscess got opened into my
and
stomach.
intubated me.
They intubated me, and the pus was pouring out of my mouth.
Subsequently, I developed gastric fistula,
Subsequently, I developed gastric fistula, biliary fistula.
and that took almost 4 weeks to heal. And
It took 4 weeks to heal.
there were no lines. So, how do you use spirituality in your professional life, or you have to leave work and then practice spirituality? I'm narrating you that how challenges in life come and they make you more spiritual. Even at that point, when I was graduating, I used to go to a lot of lectures on Gita by Swami Chinmayanand and then Acharya Rajneesh in those days. And this is subsequent to all this. When I met Brahma Kumaris at 88,
When I met Brahma Kumaris in 88,
much more.
I realized that
We are certain to Dadis.
I met Dadi Gulzarti.
She was a chariot of God.
She was Chariot of God from
2017,
69 to 2017.
one of the most wonderful person to meet.
She was one of the most wonderful person I have ever met.
And I am coming in contact with like Brahma Kumaris
coming in contact with Brahma Kumaris and then Baba's knowledge. When you say Baba, you always think of human being. But here when we are saying Baba, it is about Nirakar Paramatma. Most of you who have come for the first time, you should know that this is Godly University, Ishwari Vishwavidyalaya, established by God. This is the only university established by God. Unless and until you get into conviction, you take the knowledge. This is a rare opportunity, and this is the best opportunity for all of us that you got introduced to this knowledge. Spirituality is being taught in this institution. As well as your professional work, you will be able to balance. This is school of positive thinking. Everything is positive in this place. Even if you have problems, we say that we are settling our old karmic accounts. This is a very beautiful way of looking at life. All of us are going through same cycle. Many births we have traveled together. It is not accident that you have come here. 5,000 years back also you have come. We believe in cycles of 5,000 years. This appears little. This will appear absurd, but coming here is an opportunity to learn balancing both spirituality and professionalism. We need not take a separate time for this. Since 15 years I am in Brahma Kumaris as a student. When we get up in Amrit Vela, we get extra time. Afterwards, Murli, and now I am asking Dr. Brijesh Bhaji, who is running your hospital. You have to run the administration, you have to run your OP, and you have come here to conference, leaving your hospital. Now you have a professional life, you have family. How everything is going on? First question is about balance. When we talk about balance, I remember my childhood. In my childhood, one game used to be there, like child gymnast. Like two bamboos will be there, in between there will be a rope, and upon the rope a small child taking a stick, she walks from one end to another end. We used to see that and we used to feel so happy. How she is walking with lot of balance on that rope in between two bamboo sticks. To maintain that balance we need three things. Here also we need those three things. It depends on our potential. First thing that we require is focus. The child will be very focused on her work while walking on the rope. In our life also we need focus. What is the relationship between focus and Brahma Kumaris? My personal experience is Murli. My life starts with Murli, and I'm telling about myself. Before sleeping also I read Murli. Without reading Murli I can't sleep. My starting will be with Murli and my ending of the day will be with Murli. In Murli there will be a lot of positive inputs, and because of that the entire day my focus increases. So my focus increased because of Murli. Second thing that is required to increase focus is she carries a stick while walking on the rope. God says in Murli a beautiful thing. If you really want to make a balance in life, Baba says, whatever is there, give it to me. Whenever child walks on the rope, whatever is happening in your life, Baba says, whatever is happening in your life, it is of benefaction. It is for your benefit. Nowadays, much negativity is there, but God is telling that whatever is happening, that is happening for your benefaction. This line, it, it is like a stick in the girl's hand. It helps me, this line helps me to make a balance. Another is your claps. Whenever somebody is clapping, she should not get disturbed when she is walking on the rope. So, regarding this, also, Baba's beautiful line, whatever you are getting in life, surrender to me. It can be defame, it can be upman, it can be success, it can be praise. Surrender everything to me. We have to surrender everything to Him. Then the steering wheel of our life, you have heard in Mohit Bhai's class. So then God becomes steering wheel of your life. When I used to go to center, sister used to tell me, God is telling you, God is telling you that He is a servant, and and when God is offering Himself, then make God as your CEO. So make God as CEO of your hospital. He is very perfect. He, in running the hospital, God is very perfect. When you are there, who is running your hospital? Who is making your patients heal? He is He is running your hospital even though you are in the hospital. When I am not there, also He is running the hospital.
डॉक्टर प्रताप भाई साहब एडमिनिस्ट्रेशन संभालते हैं, ब्रह्मा कुमारीज के एडिशनल सेक्रेटरी जनरल हैं, और जितने भी ब्रह्मा कुमारीज के हॉस्पिटल्स हैं,
Dr. Pratap Mitra is secretary of Brahma Kumaris,
आई
old age homes, eye hospitals, overall head of all those things.
एडमिनिस्ट्रेटिव रिस्पॉन्सिबिलिटीज और इतनी
Taking care of these many administrative responsibilities, it is not a game because you get lot of complaints on a daily basis. How are you maintaining balance between all these things? Then all your time will be going in administration only. Then how are you practicing spirituality, and how are you maintaining balance between administration and spirituality? First of all, I would like to say whatever Dr. Bridges has said. We think that we are instruments. He is the one who is making us do. Spirituality increases our strength. It gives us a lot of patience. We can listen to people. We can have a stable mind. We can have commitment to the eternal cause. So we don't feel difficult in anything. Only thing, you have to keep yourself stable. You have to keep up your commitment. You have to be fair. Whenever we diagnose, then we keep differential diagnosis in our mind. So we have to keep all the things in our mind. When we think ourselves as an instrument, then there is no heaviness on your head and we can stay light. To keep balance, we need stability. As Dr. Bridges said, we need focus. Focused awareness is required. What is there in your awareness? What is there in your consciousness? And most important of all, the biggest thing is everything belongs to God. Here we are completely selfless, and when we are completely selfless and when nothing bad is there, then nothing is difficult for us. When we start practicing all these things, then we become perfect. It is not like initial spiritual journey, we don't get challenges. We get challenges, we get difficulties, but you should be steadfast. When you start practicing regularly and when you revise your values, then it becomes very easy. We think that what is my goal? When we keep that goal in our intellect, then nothing becomes difficult. This is our unlimited family. So, how to take care of family? Family will be taken care of with love, and we have to take care of all the sufferings, and we have to take the capabilities of, we have to see the capabilities of everyone. When you see all those things, you see that everyone has different lifestyle or everyone has a different style of working. So every physician has their own style, every gynecologist has their own style. Everyone is playing their role. In this way, when we accept everyone in their role and we accept that people will be different, their belief systems will be different, and way of doing will be different, you need acceptance. When you accept them, then nothing will be difficult. This much we have to keep in mind, that we should give respect to everyone. Whoever meet us, we should give respect to everyone. Then people feel empowered, they feel strong. So this is very important, that no one should get difficulty with our words. We should give happiness to everyone. We should make everyone go ahead. Then we will get cooperation of everyone. When we get cooperation, then things become easy. Om Shanti. So total surrenderance, being instrument of God, treating everybody as your own family, and respect everybody. These four things, personally, if I share, what is the main reason for getting complaints against doctors? Why patients complain against doctors? They say that they have not touched the patient, or doctor has not communicated properly to the patient, doctor has ignored the patient. These will be the most of the complaints against doctors. They are reading books and they are going through internet to give best treatment to a patient, but nowadays it has become very monotonous. But whatever the patient needs, the internal touch from the doctors and communication from the doctors, that was missing. So Dr. Binny is a communication expert. She traveled in the national and international countries. How you are maintaining this spiritual balance despite of traveling so much?
Very esteemed
Om
panelists
Shanti.
and all very respected dear doctors, इनको नेक्स्ट रिपोर्ट कहा गया है। अब मैं कुछ शुरुआत में एक छोटी सी जर्नी शेयर करना चाहती हूँ।
I want to share a small journey in early days of my life.
हमारी इसकी पहली फैमिली थे।
We are the first family of Brahma Kumaris. 50 years back we came here.
साल की थी।
I was just 6 or 7 years old then. We got a chance to come here, to come with parents. Since childhood, I was brought up here, and I have seen my seniors, dadis. I have learned a lot. But life journey was going on in such a way that nobody taught me spirituality especially, but I was brought up in this environment. with lot of divine
मैं
experiences.
कहना चाहती हूँ कि जब
Now I
मैं
want to
स्पिरिचुअल
add that
लाइफ में
in
मेरे
spiritual
आ
life,
रही हूँ तो इतने छोटे से थे तब से आ रहे हैं
I'm since childhood in the spiritual life. I have learned many things from the elderly seniors.
चाहती हूँ 3 P's ने मुझे बहुत सिखाया
Three
है
P's have
प्लान
taught me:
प्रैक्टिस
plan,
प्लान से
prepare,
भी
and practice. Plan means
हमारी खुद की प्लानिंग से भी
we
ज़्यादा
should
प्लानिंग परमात्मा की होती है
we have a planning, but God's planning is a bigger planning. I completed my studies and then I never thought that I will get this type of opportunity in global hospital, that I will become a public relation officer in global
इसीलिए
hospital.
मैं बहुत अपना श्रेय और क्रेडिट देना चाहती हूँ
I will give this credit to Dr.
मेरे
Pratap
साथ
Mithaji
मेरे डॉक्टर अशोक
and also to Dr. Ashok
कि
Mehta.
जब उस समय मुझे कहा गया
They
कि
told me
ऐसे ऐसे
that I should become PRO.
उन्हें एक कॉन्फिडेंस बिल्ड करना था
We
कॉन्फिडेंस
should
कैसे
develop confidence in Mount Abu people regarding hospital.
लोगों को इतनी डिफिकल्टीज आती थी
People used to have lot
उस
of
समय
difficulty here,
उन्हें लगता
um,
था हॉस्पिटल उनके मन में विश्वास जाता था
because there was no
कि हम
hospital
नहीं
here.
कर सकते हैं
So now we had to create this faith in people that this hospital is for you,
उसने पूछा
for your
मुझे
benefit.
उन्हें लेने का भी कैसे करूँ
So while doing all these
चारों
things,
एस्पेक्ट से
I got
मुझे
lot of
लगता था
opportunity to bring people near to the hospital.
मेरे साथ
I used to give answers to all the questions of people regarding hospital.
जैसे मेडिटेशन को मैं एक आपके लिए थोड़ा सा जैसे हम ये कहते हैं कि ABCD ऑफ स्पिरिचुअल लाइफ
ABCD or spiritual
ये
life.
कहते हैं कि मैं यहाँ पर इसी हॉल के अंदर
In this hall,
डॉक्टर APJ अब्दुल कलाम जब
Dr. APJ Abdul Kalam, when he came as a president here,
उन्होंने एक प्रोजेक्ट
he started a project here.
आप सभी ने उसके बारे में
You must have listened to this project,
आएंगे वैल्यूज इन हेल्थ केयर
Values in Healthcare.
को लॉन्च कर रहे थे
Vihasa project we were launching.
मुझे मिले और काफ़ी देर तक मेरे से बात की तो वो मुझे
He
कहा
met me and he
अच्छा
talked to me a
आप
lot.
जैसा
Dr. Kalam,
एज में आप यहाँ आ गए
you came into
आपने
this,
बचपन से अपनी लाइफ
then
जी है
since childhood you have learned this life, so you have to document your life
और इसको रिसर्च करिए
and you have to do a research, he told me.
मुझे प्रेरणा मिली
Then I got inspiration from Dr. APJ Abdul Kalam.
स्पिरिचुअलिटी यूनिवर्सिटी
My PhD is in spirituality.
उसके बाद उसको एप्लीकेशन करने के
After
लिए
that,
सोचा कि
to apply this,
मुझे ये लगा कि मैं परमात्मा को संकल्प हूँ कि आपने ये मुझे करवाया है तो मुझे कैसे इसको यूज़ करना
then I kept a thought in front of God. Please tell me, Father, how to use this in this hospital work. Then I used to ask God.
इंटरनेशनल प्लेटफॉर्म मैं पार्लियामेंट में
Then I got
शिकागो
then I got an opportunity from different countries, international platform also. There I went and I have learned a lot.
ये एक हम कहें कि सेंटेंस थोड़ा 2 पंक्तियाँ लास्ट में बोलूँगी कि जो रिलेशंस में मुझे बहुत मदद करती हैं वो ये है कि मैंने अपनी ज़िंदगी को यूं ही आसान कर दिया
I have made my life very easy. I have made my relationships very easy by asking sorry to somebody and by forgiving some people.
ब्यूटीफुल वेरी ब्यूटीफुल डॉक्टर किनी बहन डॉक्टर किरण दीदी कोई चैलेंज आपकी लाइफ में रहा हो
Dr. Kiran Didi,
रोज
any challenge which you got in your life
स्पिरिचुअल लाइफ और प्रोफेशनल एंड पर्सनल लाइफ ऑन वन साइड कोई ऐसी घटना
which forced you to keep your spiritual life or personal life in one side,
अगर ये फॉलो नहीं करती तो अच्छी थी
where you have felt that it could have been better if I don't follow this lifestyle. Any situation you have faced like that?
जब से ब्रह्मा कुमारी से जुड़ी हूँ
Since I'm connected to Brahma Kumaris, I never got any thought like why I came to this institute. That type of thought should never come also. After coming here, our life becomes so happy, so simple, and it becomes so peaceful that you will feel that you came to heaven. I think you also experienced the same after coming into this campus. that as if heaven has come onto this earth. Anybody experienced this after coming here, that heaven has come onto earth?
शिवानी दीदी ने आपको बताया
Shivani
होगा
sister told
स्वर्ग यही लाना है
that you have to bring Swarg here, heaven here.
अपनी लाइफ में ही लाना है
You have to bring heaven into your life.
ऊपर से उतर के नहीं आएगा
It will not come from above. We have to make heaven here.
जीने की कला सिखाई जाती है
Here we are taught the way of
वास्तव में
living.
जिंदगी तो यहाँ आने के बाद लगता है जैसे एक
So it feels like real life is started after coming here.
था
Previously also I used to have faith in God.
ड्यूटीज परफॉर्म
I
करते
used to perform my duties perfectly.
स्ट्रेंथ मिलती है
But after coming here, we get lot of strength.
ये नेगेटिविटी
Because
में
nowadays,
पॉजिटिव होके चलना
with this
थोड़ा सा
much of
मुश्किल
negativity,
कि
it
आप
becomes
ये सीखते
difficult.
जा रहे हैं
It
फिर
becomes
आपको
difficult to
अपोज
lead a proper life because people will oppose you.
नेगेटिव बिहेविंग करेंगे
Negatively they
एक्सप्लॉइट
behave.
दीदी
करेंगे
मैंने नोटिस
People
किया
will
है मेरा
exploit
एक
you.
डाउट है तो आप कॉलेज में जाते हैं बैच लगा के जाते हैं
Didi,
इसलिए
I saw that you are wearing badge. Do you keep badge when you go to hospital? I keep a small badge when going to hospital. Anybody objected you by when you keep a badge?
दे आस्क मी कि ये क्या है
They feel good and ask me. They ask me, did you get any medal? Then I say that yes, I got a medal from God. This badge is a medal for me from God.
एनी चैलेंजेस दैट यू माइट हैव
Dr.
फेस्ड
Brijesh Bhai, did you get any challenge? You are in spirituality since 15 years. Did you get any situation in your life which you want to share with people? In 2002, I started practice. I started my hospital. In 2009, I came to Brahma Kumaris. Since 16 years, I am following Brahma Kumaris. Never I got a thought that why I came here. Retrospectively, when I see, I never had fear for anything in my life. Now I feel that how did I run the hospital since 2002 to 2009. From 2009 onwards, he is the CEO of my hospital. He is running my hospital. How much are you enjoying life? I am enjoying more than 100. When I talk about miracles, many miracles I have seen. My hospital is super specialty hospital है, neuro nephro hospital है. 17 dialysis machines are there in my hospital. You know, dialysis patients, they are very fragile patients, and daily we see miracles in those patients. One I would like to share. When you surrender yourself to God, what will happen? Gwalior is a small city. Sometimes CM also comes there, and then traveling becomes very difficult. In 2011, I used to go to another hospital also. One patient was on ventilator, and we were doing dialysis for this patient. And physician told that my physician was saying, and I went to another hospital. Physician also got a very important work, and he has to go somewhere. So only 5 minutes road hai. Then I'm going to come to hospital, so you can go. And at the same time, CM is coming to the road, and then road was blocked. Physician also not there, and I am also unable to go because of CM's visit. So nobody is there in the hospital. Patient died. So a lot of havoc is going on in the hospital. So so I was thinking, whose help I have to take, whose help I have to take now. If I can't go, then if I can't go, then people will make a big dispute there. Then I was asking God, and I surrendered to God. I surrendered to God. I saw the photo of God, and I surrendered to God all the situation. You know, Baba, I stopped the phone, I offered the phone, and I slept. And all the scenes have come into my sleep in front of my eyes. That tomorrow morning it will be in the newspaper, like the patient was dead because of lack of doctor, like that. Then I started opening my phone after 20 minutes and called my brother with lot of fear. What happened to the patient? I asked. It is not their fault. Patient died because of lack of doctor. Then brother told me that I went to hospital, but the dead body was kept on the road. 30 people were there. They were doing agitation near the dead body. And very elderly person came from their own village. So that elderly male said that, why are you wasting time like this? Why are you wasting time like this? Don't do any agitation, he told. And he took the dead body, he took all the people, and he went to the village. So no news, no agitation was continued. Just an elderly man came and took them away from that place. When you surrender yourself completely and you are very truthful inside, then help from God comes always to you. It never it never occurs that God will not come to your help. Let him decide in what way he comes into your life with help. When I am calling everyone and asking help, no one came. But when I surrendered completely to God, somebody came and God has sent him and he did everything. People come to me with medical legal issues, even doctors also come to me with medical legal issues. When problem is solved, some problems will be solved easily. They come later to me. Then I ask them, your problems are solved, then why are you coming again? I'm not coming for medical legal issues. Whatever you are making us understand spiritually, we came here to take counseling from you. The way you make us understand why this has happened with us, we want to understand that there is lot of havoc going on inside the brain. We want to develop some quality. The more we apply spirituality in our life, that benefit we will be able to pass to the people who are sitting with us. I would like to ask Dr. Ashok Mehta, did you get any challenge in your life because of which you thought, or how did you handle a difficult situation with lot of any difficulty you faced in administration, any difficulty you faced in treating the patient, any challenge you faced, any challenge you faced where you have to decide between spirituality and your profession? I had several challenges of my own health. Each one of this problem was life changing. In 2010, I developed aortic stenosis. I used to go to best cardiac surgeon who was my colleague. He said you don't require replacement. Then after a couple of years, I developed malaria. 102, 103 temperature
respiratory failure,
with respiratory failure,
because that was a hypermetabolic condition, and I developed acute pulmonary edema on both sides.
acute pulmonary edema on both
I was
lungs.
warm and I felt difficulty in breathing.
I felt difficulty in
I
breathing.
drove myself to the hospital.
I drove myself to hospital.
Next day, I had put on the ventilator.
I
I
was
drove
kept on
myself to the
ventilator.
hospital. For
Both
7 days,
lungs are completely white. 7 days I was on ventilator.
I had tremendous faith
With
that I would
tremendous
be
faith,
treated in the same hospital where I was a
I
director.
I was treated in the same hospital where I was the director. After 7 days, I was extubated.
Luckily, I recovered.
Luckily, I got recovered. I went to cardiac surgeon.
I think we should operate you now
Then he said,
because
we should operate you now.
50th year of my anniversary.
On the 58th marriage anniversary,
72 at that time.
I was 72 at that time.
I had bypass.
I had a bypass
At the same time.
and aortic valve replacement at the same
Upon
time.
which
After that,
he was down
after few years,
the garden.
while I was walking on garden,
Kid was driving a bicycle.
one kid was driving a bicycle. He hit me from behind.
I
I fell and I had a fracture
required hip replacement.
and required hip replacement.
This was another major surgery.
I had another major surgery.
Hip replacement. After a couple of years,
After a couple of years, I
I
developed pain in the gallbladder, stones in the gallbladder, and gallbladder surgery was done.
few years down the line, I
After
developed
few years, I developed
disc. I used to have
disc prolapse, pain radiating down the limb.
spine surgery.
So I had spine surgery.
Then all these were major surgeries after that.
All these were major surgeries. Heart valve replacement.
During each phase of my life,
During each phase of my life,
tremendous faith.
I had tremendous faith
Somebody is
that
protecting me.
somebody is protecting me.
And it's a faith
It is
and
faith
conviction.
and conviction.
I don't see any reason
I don't see any reason
all the surgeries
while undergoing all these major surgeries,
my age.
I have not faced any problem.
I drive,
Now my age is 87. Now I drive, I go to gym,
I operate,
I
I
operate,
run my clinic.
I run my
I have
clinic.
a feeling that
I have a feeling that
spirituality
spirituality
gives you a lot of
gives you a lot of mental and physical strength
conviction,
and also
role
conviction
to play
that you have some role to play
wherever you are.
for the benefaction of people wherever you are working. It is totally unbelievable.
थैंक यू भाई साहब. तो ये थोड़ा सा हमारा एक एफर्ट था आपके साथ शेयर करने के लिए
This is a refer to share with you
conflict of
that
interest
spirituality is not a conflict of interest.
in my profession.
You need not sacrifice your profession
Actually,
to practice
spirituality
spirituality,
extra
but
time
with spiritual practice, you will get extra time to practice your profession
power मिल जाता है
and you will get extra power. And we are able to use,
इसकी इम्पोर्टेंस
now you have heard the vibrations, energy of vibrations. You can use that in healing of your patients, in maintaining your relationships.
मैं पहले सोचता हूँ
I usually think before thinking
जो सोचता हूँ
because whatever I think, it will manifest.
only my experience
This is not only my experience,
all of us
it is the experience of all of us.
सिद्धि जो आपने टीवी से अभी
Sankalp se siddhi, you have listened from Didi.
सोचते हैं वो
Whatever you think,
miracles देखे
we have seen many miracles in our life.
वो पूरा हो
Whatever we think, it will manifest.
पेशेंट लिसनिंग
Thank you for your patience, patient listening.
लेट आवर
Thanks for coming to this session in this late hour.
सॉरी I lost everything in life and I got everything back in my life.
I lost everything in my life
Very, very
and I got everything in my life. This is a short journey of 15 years.
power of thought.
It is only through power of thought and only belief.
ठीक है एक तरफ वो CEO बैठा है वो चला रहा है
He is my CEO.
एक तरफ
He is running my hospital.
सर्रेंडर कर दिया
I have surrendered everything to him.
nothing
No demand, no expectation
in the world.
from anyone in this world.
सोचा और वो सोचना भी बंद की क्या चाहिए
I have stopped thinking also
और वो हमारी
because
बात करके
our thinking will be very small and he gives us more than we think.
सब कुछ वापस मिल गया
When I started having faith, I got everything back.
I'll give everything that I want, and I think this is the experience of everybody sitting here.
This is the experience of everything who
Spirituality.
are sitting here, doctors who are
Thankfully,
practicing
thank you all the
spirituality.
panelists for
Thank you all
this
the panelists
detailed
for
session.
sharing their
Om Shanti.
experiences in this session. Om Shanti.